A declaration of interest you can clear anytime you see fit during the meeting. And moving on with our agenda, Grey Bruce Health Team Engagement. I'm going to turn it over to Jennifer.
Chair, and my telephone hasn't rung in like 72 hours, but it's ringing now, but that's okay. I'll just ignore it. It's too far away for me to do anything about. I'm just going to share my screen so I can share this presentation. Everyone see that okay?
Yes.
Okay, so this is an update just for information for committee. And you'll see that I neglected to update that this is not a draft and it's not for review for the Integration Health Coalition, and it's not October 15th, but it's for our Committee of Management today on November 9th, so apologies for that. So this is an update of what's been happening and what are the next steps with the work towards a Grey Bruce Ontario Health Team. And there's some information on this slide about what an Ontario Health Team is. They are being introduced to provide a new way of organizing and delivering services in our local communities. Under OHTs, healthcare providers across the sector come together to work in a coordinated effort to provide care and service for the people that live in that geography. The goal is to support patient, resident, client-centered care where and when they need it. And just a little bit more information about the legislation process to an integrated care delivery system. So the Grey Bruce Ontario Health Team Planning Committee was created as a working group of the Grey Bruce Integrated Health Coalition, which is a group of health leaders that have been getting together for 20+ years to look at collaborative efforts and integrated ways of improving the health system. And the purpose of the committee is to provide early oversight and direction in the creation of an OHT for the Grey Bruce region. Membership will evolve to include patient and resident, client, caregiver, and community leader representatives as the OHT matures. The Grey Bruce Planning Committee has a diverse membership made up of leaders from family health teams, community health centers, the 3 hospitals in Grey Bruce, mental health and addiction services, youth services, home and community care, physician representatives, and long-term care. And I missed paramedic services. I don't know if they're on the list, but they are definitely on the planning committee. So the first year is to goal of the planning committee for the OHT is to focus on providing care in 2 population groups, improving care transitions of frail seniors and supporting patients living with mental health and addiction issues. So the next steps is that there's an engagement session. Engagement sessions like these are happening with community sector partners. So the presentations are happening in local municipalities. The co-chairs, who are Dana Howes from Hanover Hospital and Jerry Glover from Kincardine Family Health Team, are doing engagement sessions with municipalities and other sector providers. They are attending the Grey County Council meeting this Thursday, and I encourage you to have a look at that package. It's a longer version of this presentation with a little bit more information and some specific questions nearing the end of the presentation that they will be seeking feedback and input from council members. There is also a patient, client, resident, caregiver survey that has been launched on Friday, and I can share that information with committee, and I know that it will also be shared after council, and we're encouraging it to be spread far and wide. The information that we gather from the survey will help develop the full application and make sure that the application reflects what the needs are and what the wishes are of the people that live in Grey Bruce and that use the healthcare system. And the goal is to have the Grey Bruce OHT full application submitted to the ministry by December 11th. And this engagement is just the beginning of a several year process of engagement. So it's not a one and done. The engagement will continue as the planning committee evolves and moves through this process. And so I just wanted to give our committee a heads up and some time to talk about it if they wish. in preparation of November 12th. The one piece that is a question around long-term care is, how does long-term care fit in an OHT? And that's not a really clear answer. And so there's been some discussion, and I've reached out to colleagues in OHTs at different stages across the province. And it's really still an evolution. And how we fit right now is that we provide service to frail seniors. And so we can be at the table to provide information, gather feedback, take back information to our residents and their families and our communities. And so really we're a partner in sharing of knowledge and information at this point. And that's it, if anyone has any questions about that.
Thank you, Jennifer. Does the committee have any questions of Jennifer? Seeing none? Thanks very much for giving us that preview. So we'll move on for our agenda then. We're down to Destination Care Program presentation, and I believe, Jennifer, you are going to do this too?
I am. Thank you. Okay. Everyone's able to see this presentation?
Yes.
Yes, okay, great, thank you. So I wanted to share with committee some work that's been happening, some really exciting work, an exciting project that's been happening in Grey County Long-Term Care. And it's really, Grey County Long-Term Care have been leaders in working through how to support family members, caregivers, care partners in safely visiting and safely supporting their loved one who lives in long-term care during a pandemic. And last time we met, we talked about I shared a chart of all of the different definitions of visitors. And so visiting has become very complex in an effort to support and keep safe our care communities. So we call our care partners our essential visitors. We call those family members designated care partners. And if you are interested in some more information about what's happening in the world, hashtag not just a visitor is used widely as an advocacy measure to support caregivers and care partners. So in long-term care, we recognize that while we were keeping people safe with our visiting restrictions, that also had a negative impact on the social isolation during the pandemic. We learned early on of Hotel Dieu Grace, which is a chronic care hospital in Windsor. They started a project, they call it a designated care partner project, supporting their patients in the hospital. And we reached out to learn more, and that's where the hashtag and Twitter, never underestimate the connecting value of social media. So we reached out, and Hotel Dieu Grace leadership was excellent, very supportive, had a Zoom meeting, were able to help us answer lots of questions, talk about the logistics and lots of those areas. And they shared with us their program. And so our team used the Hotel Dieu templates as a platform to create a long-term care version of a visiting program. So our DCP committee started in June, end of June, and we worked through the details of a pilot. We were going to do a pilot. We researched lots of different programs and research to help make sure that we were providing something that was appropriate for long-term care. On July 31st, we presented our pilot program to Grey Bruce Public Health, and Dr. Era and his team reviewed our policies and program, gave us some suggestions, and gave us the approval to go ahead with the pilot. In late August, we had the opportunity through the AMO conference to share our pilot program with Minister Fullerton's team. And August 13th, our first two DCPs, our residents started identifying their two designated care partners with a goal of September 9th, our DCP pilots getting into the home. It wasn't very long after that our pilot turned into a program, because the visiting guidelines changed significantly. And so then it became a program for all of our residents. We worked through the engagement process with residents, families, and team members was really important. And so most of all of our team members were emotionally affected by the isolation and the need for support that our residents had. And we gathered information from our team members at huddles. We knew that we needed to have everybody on board for the program to be effective. So what does a DCP do? They're family and caregivers that are essential to the physical, emotional, social, spiritual well-being of our residents. And each of our residents' needs are unique, and our program allows for those unique needs to be supported. There's a list here of interaction and support that a DCP might provide to improve residents' quality of life. We do have strict requirements for our DCPs. They're required to follow these guidelines. They need to attest to a negative COVID test every 14 days. And about 5 or 6 weeks ago, we started offering on-site COVID testing with our staff surveillance testing for our DCPs. They must complete education, and we partnered with Surge Learning, our education platform, and it's approximately an hour. If they are struggle or don't have access to computer, then we do have a course booklet that they can work through for their education. They must wear PPE during their visit. We've created a photo ID, and that's part of the Ontario Caregiver Organization had a project about caregiver ID, and that's this logo right here, I am a caregiver. They must be actively screened upon arrival and when exiting. They must review the DCP policy monthly or as we update it, and they must sign a commitment form that they understand and will participate in the policies, and the home also has a role to play in responsibilities in supporting DCPs. So some highlights: we partnered with Surge Learning. That allows us to easily track their education and the courses that they've completed, and the site is very user-friendly. We have an electronic tool to track screening, and that's thanks to our internal IT department. And so we're very appreciative of the knowledge and skill of our internal IT department. As I mentioned, the photo ID, the DCP emails a photo, and care committees create the photo ID on site. Scheduling, we don't require our DCPs at this point to schedule their visits. If things change in the landscape of COVID restrictions, then that might be something we implement. And we are in the process of rolling out an evaluation survey so that we can get feedback from DCPs, staff, and residents on how we might make improvements to the program. Some other highlights, we have 326 long-term care residents across our 3 homes. We have 345 DCPs registered. 170 are actively and safely supporting residents. 129 of those 170 completed their education online on Surge Learning. And we've supported DCPs in having their COVID tests 190 times to date. We have some testimonials that if we were fueled by gratitude alone, the DCP program would get us through several months. So people have been very, very appreciative, and it has really changed. It has changed the way we can support residents during a really challenging time. There's another, and I think, yeah, I'll leave the testimonial up. So that I just wanted to share this with the committee and really acknowledge the efforts of all 3 teams and team members at all of the homes. This is a program that is on top of all of the work that was happening already before an outbreak or before a pandemic. And now it's another layer of efforts. And this isn't just for during a pandemic. This changes and formally acknowledges the way we work with family caregivers, family members, family partners as a part of the whole care team to support the resident. That when someone moves into long-term care, that their community support network doesn't just get cut off, and that comes with them. And that's a part of how we provide care. And so I wanted to highlight that and share this really great news story with the committee. Happy to answer any questions if you have any.
Thank you, Jennifer, very much for doing that. Does the committee have any questions on of Jennifer? Go ahead, Scott.
Thanks, Mr. Chair, and thanks, Jennifer. Sounds like a wonderful program. I'm just wondering about residents that may not have that social connection. Is there any volunteer type DCP that would be available for people that were maybe isolated prior to coming into long-term care?
Yeah, that's a great question. And being able to add the DCPs into the care program helps support the staff and the team members to support some of those residents who don't maybe have someone that is able to sign up as a DCP or able to come in. And once we got the DCPs, that program kind of organized and supported, we are now in the talking about how can we reintroduce volunteers into the home in a safe way. And we felt that there needed to be a bit of an order, that family members needed to have the opportunity to come in safely, and then volunteers. And so absolutely volunteers are the next step and can then support those residents who don't have a DCP. And some residents and their family members opted to not participate in the DCP program for lots of reasons. Health of the DCP, ability to have the COVID test, that kind of thing. And so we still have the teams in the home supporting virtual visits, outdoor visit, window visits, outdoor visits, that kind of thing, to try to have, this is just one measure to support residents in a toolkit of options.
Thanks, Jennifer. Does the committee have any other questions of Jennifer? Seeing none, everybody's fairly quiet today. If not, we'll move on for our agenda. We'll go down to our reports. Report 2820 Long-Term Care Operating Report. Someone to move it, put on the floor, please. Moved by Christine, second by Brian. Who is going to speak to this? Jennifer, you going to?
I'll start. Thank you, Mr. Chair. So we have our operation report here. In looking at the length of the agenda, and there are some other report items that I think that we, the committee will want to have some time to discuss. Renata is going to highlight a bit of an update around the quality piece, and then where the team, the EDs are available if anyone has any questions about any of the other operational report items in the report.
Thank you. Go ahead.
Thank you. The first quarter of indicators were released by CIHI. They reflect work done from April to June of this year. As you note in Grey Gables indicators, the first two indicators of activities of daily living are reflective of the resident acuity in the home. And so they are outside the provincial average, but it also speaks to what is happening with the residents in the home. For mood and depression, working with the new RI coordinator to ensure data quality and making sure that we're addressing mood and depression in the home, if this is truly reflective of the indicator, or is it reflective of the data quality? Are there any questions?
The committee have any questions of Renata? Seeing none, Renata. So is each one of the directors going to comment or just open for questions?
I think at this point we're open for questions, and if anyone has any questions about any of the other items highlighted in the report. Okay, Brian, go ahead.
I just wanted to ask about the compliance numbers with flu shots. One home said that the compliance numbers for staff was up from last year. I'm just curious, like, would it be 80% of the staff that get involved, or what about the residents?
Who's going to answer that, Renata?
I'm just looking, so I know that there's increase in the uptake of the testing, the COVID testing, that is increasing. Karen or Shannon, do you have numbers kind of available at your fingertips or a sense around the flu shot? So the flu vaccines clinics have just started in the last few weeks.
Yeah, so for Grey Gables, when I did this report, we were around 52%, and I know we've increased, so I'm thinking we're probably around 70% right now. There has been more activity lately to get their flu shot done.
Okay, that's really what I was looking for. I thought it was maybe more important this year than because of the pandemic, and I'm just wondering if the numbers showed that. So that's good enough. Thanks.
Thanks, Brian. Scott, go ahead.
Thanks, Mr. Chair. Just the quality indicators, just wondering whether the provincial averages have increased over the last 9 months with COVID. Does anyone have any idea whether the overall average has went up? And it's certainly nice to see that, you know, we're more than beating the provincial average. Like a lot of ours, you know, you look at Hes Payne, like we're significantly lower than the provincial average. So, you know, kudos to all the staff. You know, a lot of our averages are well below. So thank you.
Okay. Christine, go ahead.
Thank you, Mr. Chair, and good morning to everyone. With regard to the quality indicators, and I see a progression of increase for meeting or exceeding all of the percentages, like the mark thresholds. So well done to everyone involved in that. My question is there anything more that this committee can do in terms of resources or support to assist the executive directors and you, Jennifer, in terms of getting more green, even though you are in the green indicators better than Ontario average? What can we do as a committee or as a council do to support you even further? Thank you.
Jennifer?
Through you, Mr. Chair. Thank you, Councillor Robinson. So what can you do to support us? The committee is very supportive in hearing our reports and asking very thoughtful questions, and so that is very helpful. The budget or the reports that are coming up, we have some budget discussions coming up around, and we'll get to that, around investments in some IPAC staffing, and the budget also reflects a proposal for some increased, some purchases around programming. So there are resources connected with the software that we use for point-click care that helps support our data analysis and knowing what kind of the next steps are, what should our groups be focusing on. And additionally, the support of the committee and council in the quality and accreditation specialist position. And so Renata is, you know, just dipping her toes in the first, you know, several months of her new role in the middle of a pandemic. And so I think the continuing to ask us good questions and also have some patience as we work through balancing how do we improve care and quality and sustain all the things we need to do around pandemic and pandemic preparation and being fiscally responsible and all of those things that we're trying to balance, all in the spirit of making sure we have great care in our homes. And so I don't know if that really answered your question, but that's kind of where I think at this point where we are right now in just balancing everything.
Well, thank you. Thank you, Jennifer, and through you, Mr. Chair. I really wanted to utilize the question and you answered it incredibly well. Thank you. But I really just wanted to use that as an acknowledgement of that this committee absolutely supports the long-term care senior management and the staff involved, and that I used it as a check-in, as just to see if there was anything more that we could do, or look at a different type of perhaps philosophy, or support through financial and asking the questions and the different projects that come forward, and certainly Renata's new position, which I think is incredibly valuable. So thanks. I will again check in, but I do appreciate the response. Thank you, Mr. Chair.
Thank you, Christine. Does the committee have any other questions on this report? Seeing none. All in favor? Well, maybe I should say, is anyone opposed? Yeah, I think it's a common practice. It's none. Okay, we'll move on for our next report is 2920 long-term care update. Someone to move and put on the floor, please. Moved by Scott, second by Brian. Who's going to speak to this? Jennifer?
Yeah, thank you, Mr. Chair. So this is our COVID update for the committee, and I didn't acknowledge at this point that Stacey Goldie, our executive director at Lee Manor, isn't on the meeting today. She's at Lee Manor supporting the home as they work through a potentially false positive test of an asymptomatic staff member. And so the result came in yesterday, and the staff member is being retested. We're working very closely with public health. It's not deemed to be a high-risk situation. However, out of an abundance of caution, while we wait for the retesting results, they are implementing some outbreak measures at the home. And so yesterday, all of the residents and their power of attorney's family members were notified of the situation. And so there's a lot of work going on at the home. And so Stacey's there providing that support. And that just gives you a little bit of an update on where we're at Lee Manor today. And as soon as we hear any information on those test results, we will be sure to pass that information along. And so communities are now in the 8th month of the COVID pandemic, and the second wave has hit our province. Our care communities do continue to be vigilant and adapt to changes. We currently don't have any COVID-19 cases in our home. And we just talked about the Lee Manor situation today. We did have a rhinovirus, which is a common cold outbreak at Lee Manor in September, and it was quickly resolved. So in terms of updates, we continue to offer the interval surveillance testing for staff. We have provided refresher education to all staff at team huddles, as COVID fatigue is a thing that we're all experiencing and aware of in our work and in our own lives. And so we offered some education refreshers. We did begin offering our designated care partners testing on site, and our medical directors and the clinical teams in each of the homes have worked really hard to pull that together. And they, as I mentioned, they're very grateful. And at Rockwood Terrace, our paramedic services department is partnering with Rockwood Long-Term Care to offer that testing for our DCPs. And that clinic was today, starting today. So that's really good news, and we appreciate the partnerships. We continue to have suspended our short stay absences and day trips. This was a difficult decision, but the risk associated with outings and day trips outweighed the benefits. And so we continue to focus on having people visit safely inside. And we do receive requests for special circumstances, and we assess those on a case-by-case basis. And that does not apply to medical appointments. So we have not limited people going out for medical appointments. We talked about our DCP program already, and we are working with a small collaborative group of Hotel Dieu Grace, Briere, which is a group of long-term care homes in Ottawa, and a couple of gerontology consultants, and we're working on a evaluation research project. We applied for a grant through the Canadian Foundation for Healthcare Improvement. And the writing of this, which I think was just last week, we received word that we had received approval. And so Grey County Long-Term Care will receive $10,000 and coaching as part of the Long-Term Care Plus Acting on Pandemic Learning program that the Canadian Foundation of Healthcare Improvement is supporting. The objective of that program is to help us address the current impacts of COVID-19 and share information and knowledge sharing across the country. And I've attended a number of huddles, virtual huddles that CFHI have put on, and I've gained lots of really good information from other parts of the country. We're excited to be a part of the program, and we'll provide updates as we work through the process. On October 2nd, the province announced that PSWs, personal support workers, would receive an additional $3 per hour pandemic pay until March 2021. We are still waiting for more details of that announcement. So we will keep the committee and our team members posted whenever we get information on the details of that. Our recruitment strategies continue to be ongoing. Our HR department's been assisting with onboarding, and we continue to really appreciate our emergency support workers who support our staff who are working tirelessly to look after our residents in the home. And we are happy to report to the committee that emergency support worker position has transitioned to a permanent care support assistant position at Rockwood Terrace. We have had recent discussions with Georgian College related to possible educational options for individuals interested in long-term care and health careers. And we look forward to working with our education partners and our economic development team on these initiatives to support health human resources into the future. So we're working on what can we do today, and what can we do for 2 years from now? What seeds do we need to plant today so that we can have support new people into the field? Our PPE supply is at 8 weeks of level, and that is recommended by Ontario Health West. And so the homes have done ordering to get us to each home to that place. On October 14th, the Ministry of Long-Term Care released an update to Directive 3 that establishes 3 types of absences, and noted that the Ontario hotspots were suspending all absences except for medical and compassionate reasons. All of our visiting options remain available, so virtual, window, indoor, and outdoor. And our care communities are working on how do we address the colder weather and our outdoor stations. And so we're looking to some of our neighbors who have snow already and seeing what innovative things they have done and what might we do to support visits in February in snowy Grey County. We've talked about the influenza vaccine campaigns are on. And November 2nd, our care communities released our first introduction to a new communication tool that is directly to resident families and substitute decision makers, and it's called Clinic Connects. And this will allow us to communicate directly with those family members that in a way that works for them, so they can choose phone, text, email, and it's through our point-click care. And so it addresses privacy and all sorts of other things. And the opportunities are really great in making sure that we can keep our family members up to date. I wanted to just highlight the 240 days of our care communities remaining COVID-free has been lots and lots of work. And in the report, there's a chart that I'd just like to draw your attention to. And when I touched base with the teams and asked them to pull together some of that data, it was, the numbers were much higher than I was expecting. And the days just roll into one to the next. And it was an opportunity for us to really acknowledge the amount of work that is happening in every department across all 3 of our homes. And, thousands of COVID test swabs done. hundreds of DCP tests. The isolation, so our part of our strategy is one symptom, high surveillance of our residents. Our residents have one symptom and we automatically support that resident in isolation, have them tested and work through that process. And we've, across our 3 homes, we've supported residents in isolation 138 times. So that's a room move. That's making sure the resident understands and is okay, and that their family members have been communicated with, and strategies outlined with staff. And so these are significant and very important, but I wanted to acknowledge the amount of effort. Thousands of visits, thousands and thousands of visits. So there are 3 posters attached to the report. Have a look. We took the opportunity to gather these stats and some photos of staff supporting residents and each other. And the posters have been printed and are at the homes, and a way to say thanks and acknowledge all of the work. And you'll notice in all of the pictures, behind the mask, you can see that all of the staff are still smiling, and you know, they still have joy and they're laughing, and so it's so heartwarming to see. Our partnerships continue across the sectors, and again, really appreciative of the committee support, the support from my CAO and our senior management team and the leadership team. And that's our update for 8 months in.
Thank you, Jennifer. A question I would like to ask before I go to Brian. On the PSW extra, what's the word, donation, is it retroactive? Or do you know?
I probably, yes, but those are the details that we just don't have from the province. So there was an announcement that said there would be more details to come. And I know Advantage, our association that advocates and supports us in long-term care, is trying to get more information, and our finance team is watching for information, and there just hasn't been anything detailed at this point as to how it works, what the eligibility is, any of those details.
Thank you, Jennifer. Go ahead, Brian.
Thank you, and through you, Mr. Chair. Jennifer, you touched on the outdoor visits a little bit there, talking about, you know, how you're going to visit in February when we have snow, but what's the expectation of these numbers? Like, you have nearly 2,500 visits, outdoor visits. What are those numbers going to turn into? Are they going to turn into indoor visits or virtual visits, or a combination? Or if they are indoor, are we prepared for that?
Yeah, so it's very hard to predict. We do have a scheduling system, an online scheduling system, that so we can at least kind of monitor the requests that are coming in around visits and try to adapt. It's really going, there's a few variables. So right now, outdoor visits and window visits and virtual visits are the only way you can visit without having a COVID test. So we recognize that we need to be able to support visits in some way without a COVID test. In order to come in and do an indoor visit under the current guidelines, the visitor must have had a COVID test in the last 14 days. I don't believe, we're not looking at a way to take residents out of the building into the snow at this point to do some sort of an outdoor visit. So we're looking at how can we enhance the window visits and make that experience less snowstormy for the visitors on the outside of the window. And how can we make sure that the visit is a decent visit using technology so that the resident can hear and the person on the other side can hear. We use phones and we use a virtual connection, but they can see each other. And so we're looking at, is there a way to create a bit of a sheltered space outside for the visitor on the outside of the window? And at that point, that's where we're at right now. And there may be other innovative things that other homes have done that we don't know about yet. And so we're exploring that.
Do you have a sense that there might be some intimidation involved in terms of the virtual visits? Like, you know, maybe some of the people are a little bit nervous about trying the virtual visit just because they don't understand it?
At first, there was for sure, and the program teams in the homes did a lot of technology coaching of family members getting used to their computer and figuring out how to do it. And but the uptake has been amazing, and even just the DCP numbers of the number of people that did the education online. I don't have a number to say how many are a senior, but a lot of them are seniors, and a lot of our visitors are seniors, and they have really adapted very well to the virtual. And so we do have team members that will support people in learning how to do their virtual visit. So I think it's less of an intimidation now than it was in March and April.
Okay, thanks. Great report.
Thank you.
Yes, it is. Does the committee have any other questions of Jennifer? Go ahead, Scott.
Thanks, Mr. Chair. And through you to Jennifer. Jennifer, you touched upon the emergency support workers, and I believe the province has renamed those. So are those permanent positions going forward? Is my first question. Are you hearing me?
I just missed your question.
Okay, so I believe the emergency support workers, I believe, you know, is that become a permanent type position or recognized position within the province? And if so, how do we plan to implement those positions within our 3 homes?
Thank you, Councillor Mackey, and through you, Mr. Chair. So yes, the province, and I think that this just happened yesterday, so I'm not completely up to date on all of the whatever came out yesterday, but what I did see was the province calling that position a resident support assistant. And what we've been calling that position is a care support assistant. And so the name is very similar. And the province has made an announcement yesterday, but I'm not up on it enough to be able to speak to what the announcement was yesterday or the day before, and how it impacts us in our long-term care homes. What I can say is that Rockwood Terrace leadership and union leadership and the team there ratified their collective agreement, and it does include a care support assistant classification, and has language to support the use of care support assistants to support the care team. So to support PSWs and other departments. And just for clarity, is in no way intended, and the province doesn't intend this either from what I've read, it is in no way intended to replace the trained personal support workers. It's to support in a time where we know there are not enough people with PSW certification to fill the vacancies. And so our goal in Grey County long-term care is to encourage people to be an emergency support worker or a care support assistant, and then if they love it, take the education as a PSW, and we would then support them and hire them as a PSW. And so the CSA, or the emergency support worker, helps bridge some time that it takes to get people trained to be skilled PSWs.
Thank you, Jennifer.
Thank you. Do we have anything, Mr. Chair, and through you, Jennifer, do we have anything in our budget to support those support workers that may wish to enhance their educational or become PSWs?
That is not built into the proposed budget we're discussing today. However, we're open for discussions of it. We're in a time where we need to have some outside the box thinking in supporting the health human resources crisis that exists not just in Grey County, but across the province.
It certainly might be something to consider. A lot of employees that have long-term employees will certainly support their continuing education. So it may be something that we want to have a look at. Thank you, Mr. Chair.
Thank you. Before I go to Christine, Madam CEO.
Oh, just to add that this is something that economic development has also been engaged in discussions with Georgian College on future programming as well. So there are some things that we're trying to develop in support of what you're saying, Councillor Mackey.
Thanks, Kim. Christine, go ahead.
Thank you, Mr. Chair. Councillor Mackey certainly asked my question, and it was in regards to supporting long-term care workers and how we can, as a committee, ensure that we're doing everything possible on behalf of Grey County residents to support long-term care workers that have dedicated their career to assist in helping others. So thank you, Councillor Mackey, for bringing this forward, and Jennifer and Kim, thank you for your responses.
Thank you. Is there any other questions on this report? If there's none, is there anyone opposed to the report? Seeing none, we'll move on to our agenda. The agenda's deliberately put this way. I take it for sake of time because it's not in order. I'll go to the next thing on my agenda is report 3120. I believe it was moved by Christine. I need someone to second it. Second by Brian. And all I got to do is find it. Do I count on Jennifer to look at this, or there's?
Joanna is going to.
Yes. Yeah. Good morning. Thank you, Mr. Chair. So this report provides a financial projection to year end for the long-term care homes based on the actual results to September 30th, 2020. And it also includes an update on the financial impacts of COVID in 2020. So I'll actually begin with COVID. So the home budgets project total COVID expenditures of just under $3 million for 2020. That includes about $1.1 million in temporary pandemic pay, which is that pandemic pay that was paid to our staff between April and for work done between April and August. So of this almost $3 million, $2.2 million of funding has already been received from the ministry. So, and that's through the pandemic pay as well as through the COVID containment and prevention funding that the ministry has been flowing to us on a monthly basis. This leaves approximately $772,000 remaining, and those costs are recommended to be funded through the federal provincial Safe Restart municipal operating funding. So COVID is basically funded, fully funded for 2020. So I'll just then go back to our actual operating results. So we anticipate an overall balanced budget for 2020 for the three homes. So I'm just going to briefly touch on a few points. Long-term care administration is the director's office and her staff. And the cost of this department is funded by each of the three homes in proportion to the number of beds each home operates. So any savings, which we do anticipate savings this year because of salaries and benefits that were lower than anticipated because of hirings that occurred later in the year. So those savings are distributed to each of the homes. So in terms of each of the homes, I'll just kind of talk in general because all the three homes are facing sort of similar situations. So all three homes have higher than anticipated revenues. And I think we've talked before in other reports about the funding announcements that came. So we did budget 1% level of care increase. We received 1.5%. We had some decrease as a result of the CMI, but then we also received funding for 5 additional bed licenses in total for our three homes. In addition to the ministry funding, we also had co-payments from residents for those 5 additional funds, 5 additional bed licenses. So salaries and benefits, while we do have staffing shortages that result in savings from unfilled shifts, staffing shortages do give rise to unbudgeted overtime and agency costs. So that was pretty consistent across the three homes. Raw food was also overspent across the three homes. And we did have maintenance of buildings, staff training and development, administration charges, and physiotherapy expenses that were all underspent as well in 2020. And so savings from these provide surplus funds to offset any estimated over expenditures and are contributing to the overall projected year-end position. So we anticipate a balanced budget for the 3 homes, and I'm happy to answer any questions.
Thank you, Joanne. Does the committee have any questions? Seeing none, a great report.
Thank you.
Anyone opposed to the motion on the floor? Seeing none. So we'll move on with our agenda. We're down to report 3220, and I believe this one was moved by Christine and second by Scott.
Thank you, Mr. Chair. So the ministry is flowing to all long-term care homes in Ontario what's called infection prevention and containment, or IPAC, minor capital funding. So back in September, the ministry announced a $540 million funding to the long-term care sector, and of that, $61.4 million was designated to improve minor capital upgrades and improvements directly linked to IPAC practices for the safety of residents and their staff and families. So this funding our allocation of it is just under $267,000. And this funding, so I've been working with the executive directors to try to identify some projects that would meet the criteria for this funding. So the projects are all identified in the report as to how they intend to use the funds. The funds, they will not exceed the funds that they've been allocated, and the funding must be spent by March 31st, 2021, or the province will claw back. So if anyone has any questions.
Questions of the committee. Brian, go ahead.
Thank you, through you, Mr. Chair. Thanks, Joanna. My question is probably for Jennifer. I'm just wondering if there's only one home, the Grey Gables, that are doing something for staff. They're modifying the change rooms or something, but I'm just wondering about how much of this conversation is involving staff when it comes to having money to spend. Is there other things that we can do for staff other than like modifying a change room?
Thank you, and through you, Mr. Chair. There are some very strict criteria around what is eligible for this funding. Grey Gables has so I'm confident, and the EDs can speak to this, that in an effort to identify what should the money be spent on, there was discussion with frontline team members at huddles and in identifying gaps around some of our infection control. And we have significant audits that we use, infection prevention and control audits that are provided by Public Health locally, Public Health Ontario, and through our policies that help identify areas where we could make improvement or we could make the process a little bit easier. So that engagement did happen. Grey Gable, part of our strategy is best practice guidelines, and our policy requires staff to change their uniform, change into a uniform when they arrive and change out of it when they go home. And Grey Gables is one of the locations that has a really challenging space to accommodate that safely and to make it easier for staff to do that. With regards to staff, anything else for staff? I don't know, Joanna, are you able to speak to some of the restrictions? Like we are regularly looking at acknowledgement and recognition opportunities for staff, and agree that that's really important, especially as we head into months and months of this hard work. I'm not sure that some of those items would be eligible under this particular funding. Joanne?
Yes, through you, Mr. Chair. So it does, we received a letter from the Minister of Long-Term Care, and he advised that, the letter advises that minor adjustments to support distancing are permitted, renovations to support improved distancing of residents, it does say. It's pretty vague, and there is another sort of a catch-all that says other expenditures designed to help equip homes to prevent the spread of infection may be considered at the ministry's discretion. So we could approach, if there was a particular project, we could approach the ministry with a request.
Brian, does that answer your question?
Yeah, I think so. I was just curious. Like, you always worry about staff. You know, if staff at Lee Manor are saying, "Oh, look what they're doing at Grey Gables. Why aren't they doing anything for us?" sort of thing. But I'm just wondering how the conversation went around that.
Yeah, and we have a.
We lost Jen.
Chair, I wonder if you want to, while we're waiting for Jen, I think the questions were answered from Jennifer and Joanna. So I'm wondering if, just to keep moving, if you want to call the vote on that particular motion.
Okay.
Yeah, I just wondered if for example, if Karen could state what Rockwood's got for change rooms and stuff, and maybe that would even help understand.
Sure.
Thank you, Kevin, and through you, Mr. Chair. Our change room is really not adequate for the changing that's going on in there right now either. However, it's kind of locked between the kitchen and things in the back hall. So I don't know what we could do to support it. And our other areas are so confined that I'm not even sure we have another area we could open up for that purpose. We are making do, but it is quite cramped, particularly at shift change when everybody's trying to get changed and get to the floor.
Thank you for that, Karen. I see, Jennifer, you're back live again.
Sure, I don't know where we are.
Verona, maybe you could mention what Lee Manor's got. That would help Councillor O'Leary as well.
Lee Manor's change rooms are also quite small, and part of the capital budget this year, one of the projects was to not only the ice cream parlor area, was to enhance the staff area and the change room. So that project has been deferred to 2021. So it requires a substantial amount of investment, or more of an investment than what this funding offers to improve the change rooms at Lee Manor.
Thanks for that, Renata.
Thank you.
So hopefully that answers your question, Brian. And Jennifer, I believe, did you have any other comments, or you're done? Okay. Is there anyone opposed to the motion before us? Seeing none, we'll move on for our agenda. Our next item is report 3020, the budget. And I believe, Christine, you have moved us to, and it'll be seconded by Brian. And I believe, Joanna, are you going to move this forward, or Jennifer?
I'm going to start. It's going to be a partner approach. Okay, thank you very much. And I have my fingers and toes crossed that my internet remains stable. So thank you, Mr. Chair. This report, and I'm afraid to move my mouse to read my documents. So there's something connected with my mouse and my internet connection, and it makes no sense to me, but I believe that it's real. So this report is regarding the proposed 2021 long-term care budget, that it be received and forwarded to County Council as part of the overall corporate budget package for consideration. The Committee of Management is responsible to oversee the budget for Grey Gables, Lee Manor, and Rockwood Terrace. This budget was developed through the collaborative efforts of the Grey County Finance Team and the long-term care leadership and staff. This 2021 long-term care proposed budget contains operating and capital expenses of just over $36 million, and it includes a net levy requirement of just over 7 million, just over 7.6 million, which is an increase of $545,800, or 7.71%. The promise of Grey County long-term care is to color it your way by providing resident-centered care. Resident-centered care is supporting each resident with their unique care needs for both their physical and emotional well-being, and this care and support is provided by our team members in each home. Resident-centered care is achieved through the many moving parts that makes up Grey County long-term care. It's through leadership, it's through team members in all departments, with a focus on good, nutritious food and meals, a clean house, and the creation of a safe and community environment. It's through the collaborative and combined efforts of all of those pieces that creates the resident-centered care. And this proposed budget supports this promise with an investment in a number of areas. So an investment in frontline care hours in the nursing and recreation departments, a focus on nutrition and meal service, an investment in registered nursing hours for infection prevention and control, and an investment in the building and maintenance upkeep. The 2021 budget increase, as I mentioned, is a net requirement increase to the levy of $545,800. And that's comprised of an increase of cost of living to the salaries and benefits, $16,200 for capital increases, $21,000 invested in raw food budget, and then some home-specific initiatives that are outlined below. And so that's a summary overview of what's in this proposed budget. And Joanna is going to take us through the numerous complex levels of this funding system. And if we can do it either way, if you have a question as we get to one of the items, then just feel free to ask and we can have a discussion about that specific section, and then we can move on or save your questions for the end, whichever is best for you. And I'll pass it over to you, Joanna.
Go ahead, Joanna.
Thank you, Mr. Chair. And I might just share my screen so that we can just move along together. Do you see that?
Yes, we do.
Okay, so I'm just going to touch on a couple of key points. So in terms of budget impacts on the revenue side, the homes operate with 4 sources of funding, or of revenue, sorry. The first is the Ministry of Long-Term Care funding, which includes the level of care based funding, the global level of care, and the case mix index. The second source of revenue is the resident co-payment, the share that the resident pays. The third source of funding is any other income, donations, rentals, and the last is the County of Grey levy, the taxation. So this budget proposes a 1.5% funding increase for through the global level of care in the 2021 budget. In the previous year, we assumed a 1% increase to each of the 4 envelopes, and the province provided us an overall increase that we could apply to any of the envelopes. So we've decided to have a 1.5 funding increase effective April 1st, 2021. We've also included the 5 additional bed licenses this year. Last year we didn't know about them, so we didn't include them, obviously. So this will be in place for the entire 2021 year. And as a result of the funding increase and the additional bed licenses, we anticipate additional funding of about $280,000.
Joanna, may I interrupt you just for a moment, please? I cannot see the screen, so if anyone has a question, just please speak up. Okay?
Okay.
Go ahead.
Okay, thank you. So the case mix index, the unpredictability of the CMI is a risk when developing the budget. In 2020, the CMIs all decreased, resulting in a funding shortfall of $147,000. As in previous years, this budget was prepared using the current year CMI. Structural compliance and minor capital is the structural compliance premium 1999 program. It ended in 2020 for Grey Gables and Rockwood Terrace and was replaced in 2020 with the minor capital program. So in 2021, Grey Gables will receive this amount, 72,264, and Rockwood will receive 91,248 in minor capital. This program will be phased in, so every year, unfortunately, we'll get less. This money cannot be applied against operating expenses and will be clawed back if not used on minor capital projects. Lee Manor will continue to receive structural compliance premium because they're on a different program, and they'll get $273,000 a year. The resident co-payment, the rates generally increase every July 1st. In this year, the increased rates were deferred to January 1st, 2021 to provide relief to residents and families that may be experiencing financial challenges due to COVID. So effective January 1st, 2021, basic accommodation rates will be increased by 1.9%. So this will result in approximately an $18,000 increase in preferred accommodation revenue in total for our 3 homes. So that was the budget impact on the revenue side. I'm going to now talk about the budget impacts on the expenditure side. Are there any questions about the revenue impacts? Okay,
May I
so I'll just.
Mr. Chair, may I jump in here?
Go ahead, Kevin.
This is one thing when our fundings drop with, for example, CMI and stuff, and we end up getting similar funding from the previous year. When you're cost shared so heavily with either the province or the residents, and we don't see any movement on the revenue side, or we actually lose, when you have like half of your funding coming from that source and you're not gaining anything, and then you have a 1.5%, for example, increase for wages and benefits happening, those end up being like a 3% increase then, because you're not getting the equivalent revenue side going up. So it is a struggle, and we're regulated and legislated so much on the revenue side. There's little here that we can do. If there's items that the committee thinks we should investigate to enhance our revenues, I'd love to hear them, but I'm just wanted to speak up and demonstrate how losing revenue, for example, for CMI and stuff, it does impact going forward on the expense side.
Thank you, Kevin.
I see Councillor Mackey had his hand up, Chair Burley.
Go ahead, Scott.
Thanks, Mr. Chair. I guess, the question is, in light of, all the issues that we've seen in long-term care, and the province, I think, is beginning to recognize that there hasn't been the funding that maybe should have been, given to long-term care. Are we expecting to see, has the commissioner's report, one question, has it come out yet and made any recommendations in regards to the funding levels that should be given to long-term care? Secondly, do any of our senior managers expect to see, any movement from the province in, funding long-term care the way it should properly be funded? Thank you.
Go ahead.
For you, Mr. Chair, very, very good questions that don't have any very, very clear response. You're right, there's been more discussion and more attention shared on long-term care recently than ever before. And so we'll look for the silver lining. That means there's lots of discussion about what's possible and what could come. So the commission, to answer your first question, the commission released some early recommendations. They have not released their report, as far as I know, but they did release some early recommendations because they felt that it was necessary that their list of comments, a short list, be released in a timely way. And it does address the direct care time, and we will talk about that a little bit later in this report. In terms of provincial investment, what do we expect? So the province has made an announcement that they will be moving to more to that 4 hours of recommended direct care time in coming years. And I'm just trying to remember if it was 2024 is what the announcement spoke to. And there have not been a lot of details about what that actually looks like. What does that direct care 4 hours, what does that look like? And so there's lots of discussion, and hopeful that more details and more clarity will come as we work through this. Does that kind of answer your question?
Well, that was a really good attempt, Jennifer, and I know you don't have all the answers. I guess for the committee, anytime that we're having discussions with our provincial counterparts, to highlight that the Grey County taxpayer is paying $7 million towards long-term care. And I support, you know, those dollars being spent. I think they should be coming from the province and not from the county. You know, we're providing the quality of care that should be provided throughout the province. And I think it's very indicative of, you know, how well things have been going up here in Grey County. But I think the 7 million share should be more equally split with the province. So that's just my comments. Thank you.
Thanks, Scott. Christine, I believe your hand's up.
Thank you, Mr. Chair. I was wondering if the committee members and staff, of course, thought there would be some value in requesting a virtual meeting with the Minister of Long-Term Care during the Roma conference, which is happening. It's a virtual conference for 2021. I do know that the deadline is November 30th. So this would be, I guess, a prime opportunity to determine whether that is an option, and then obviously taking the request through to County Council. Wondering what my colleagues think. Mr. Chair, with regards to funding, sorry, the item that we would suggest that we meet with the Minister Fullerton would be with regards to funding and the challenges the challenges that we face. Thank you.
Good suggestion. I'll leave it up to the committee what they feel this conference.
Chair,
Go ahead.
through you, we do have Roma delegations on the council agenda for Thursday. So this would be something that we certainly, one of the members could bring to that discussion Thursday at the end of committee of the whole. It is under other business. So that's certainly something that the committee member could bring that forward.
So Councillor Robinson, look forward to you bring that forward.
Oh, certainly. I recognize that it's on the agenda. I wondered if it was just something that as a long-term care committee, we would determine whether there would be value in that and then taking that forward on Thursday. Whatever approach works. Thank you.
Thanks for that, Heather. We, before we move forward, there was a question I wanted to ask and I forgot what it was. It was to do with Rockwood getting funding. Is our new bill going to impact any capital money we get coming towards Rockwood? I don't know who might answer that or try to, or Kim, are you able to answer?
I could try, Chair. Like new money for capital, the redevelopment, they did announce some like upfront funding that they would provide based on where the homes were being built. Like rural had a different percentage and stuff. But I haven't seen anything in the budget document about further enhancement and redevelopment. No. So I still think we're kind of on the path of where we were prior. And so I haven't learned of anything new.
Okay, thank you. Okay, so if there's no other questions, we'll move forward. I believe Joanne, you have the floor.
Thank you very much, Mr. Chair. I'll just share the screen again if that's okay. Okay, can everyone see that?
Yes.
Salaries and benefits. Okay, so wages and benefits account for over 80% of the 2021 budget. So challenges with recruitment and retention of qualified employees leads to a high dependence on overtime and use of agency staff, both of which have a direct impact on the basic cost of service delivery. So as Jen said, this budget proposes an investment in direct care staffing hours to support the complex physical and emotional care needs of our residents. So I prepared a table here. There has been, as Jen mentioned, there has been a lot of discussion about the 4 hours of direct care per resident per day. So I calculated that number for our 3 homes, and we were recently in an educational session, and the director of long-term care from Lanark County spoke, and she had prepared hers as well. So she didn't mind if we used her numbers as well as a comparator, just to sort of see where we land compared to other homes in other municipalities. So this is a home with 163 beds. So the direct care there is right in line with our homes. So I don't know if Jen wanted to speak on this.
Jen?
Sure, thank you, through you, Mr. Chair. So I really just am able to, we can do our best to answer any questions. It is helpful to be able to look at the chart and have a sense of what's happening. And it isn't, though, as kind of black and white as comparing apples to apples. And so it does give you a sense of what the care team's direct care hours are. But for an example, Grey Gables is a very small home. And so there are fewer RPN hours supporting the residents. There's the appropriate, it meets the legislative requirements but there are more PSW hours supporting the activities of daily living. And so some of them balance each other out. And so just when you look at the chart, I encourage you to look at the kind of whole picture and see how they support each other. And so the clinical team supports each other, the different positions, and they may do some slightly different support tasks in one home than in another. And then otherwise, I'm just happy to answer any questions about this.
Thank you, Jennifer. Does the committee have any questions? Seeing none, I guess, Joanne, you'll move forward.
Thank you, Mr. Chair. So raw food, so the ministry provides $9.54 per resident per day for the purchase of raw food, and this is unchanged from 2020. So historically, we have operated this funding envelope with an 18-cent per diem levy requirement. In 2020, we removed this levy amount, and in 2021, we'd like to propose adding it back to fund the purchase of locally sourced beef. So the total cost of this levy requirement would be $21,100 for the 3 homes. So COVID pandemic. So over the past several months, the COVID pandemic has had a significant impact on the finances and operations of the long-term care home. The financial implications are difficult to predict for 2021, given the unknown duration of time this pandemic will last. Homes have proposed a total of $1.9 million in COVID expenditures in 2021. This includes increased spending relating to additional staff, personal protective equipment, cleaning supplies, equipment to support infection prevention and control measures, and screening and testing initiatives. We also anticipate that the Ministry of Long-Term Care will continue to provide COVID containment and prevention funding, so that will cover $1.3 million of that cost. The shortfall of $661,000 we're proposing will be funded by the Federal Provincial Safe Restart Agreement. And therefore, there is no budgeted levy impact for COVID in this budget. So I'll just really quickly touch on some budget impacts per home. Are there any questions at this point, or should I just continue?
I haven't heard any questions so far, Brian.
Mr. Chair?
Well, go ahead, Scott.
Just in regards to, the food in the province, not giving an increase to the food, I can't understand why they wouldn't, look at food costs. Everyone recognizes food costs have gone up over this year. So to me, that's certainly an area that we could, speak to the province about. Not to give an increase in food just doesn't make any sense to me. And I can't see their justification for that. I certainly support, providing the extra 18 cents for, locally grown beef. But again, that should be on the province, not on us. So, I mean, I'm not sure what a private home would do in regards to no increase in their food budget. But anyways, just I can't rationalize in my head why the province wouldn't increase, at least by the cost of living, the food envelope. Thank you.
Good comments.
Thank you, Councillor Mackey. Just to comment on that, the province has stopped funding the envelopes directly, but does provide a 1.5% increase through the global level of care. We really could allocate this funding to whichever envelope we want. So the reason the province is doing that is to provide flexibility to homes to allocate their funding to whichever envelope they want. We have traditionally put this funding increase into nursing and personal care because that's where their levy is the highest, but we could certainly move some of that into the raw food.
Thanks. I have no issue whatsoever in supplementing our food budget so that the people can have locally grown products. Thanks.
Okay, thank you.
Thank you. See no other questions, Joanne, go ahead.
Okay, thank you. So I'll just talk in very general terms for the 3 homes. All 3 homes are proposing an investment in RN infection prevention and control. So 8 hours per week across all 3 homes. In addition, Grey Gables is proposing a 1.72 hours per day for dietary, 7.5 hours per day for PSW, and 7.5 hours per day in recreation. Lee Manor is proposing 8 hours for RPN and an additional 15 hours per week for scheduling on weekends. And Rockwood is proposing an hour a day for laundry, 8 hours a week for recreation, and an additional 7.5 hours per week to support the front office. All of their capital is consistent with what was presented to the committee for the 10-year capital back in May. The only additions would be anything that was carried forward from 2020 that's been added. And that's really all. We're going to continue the $1.361 million transfer to reserve to assist with the redevelopment of Rockwood. That will continue as well. So happy to answer any questions.
Great report. Does the committee have any questions? Kevin, do you have any comments?
On your motion, I wouldn't mind, like, staff are continuing to review these budgets, and then if there is further information from the ministry provided on enhanced funding, we would like to make those changes. So, maybe in the motion that, staff continue to review the 2021 proposed long-term care budget with the intent to make further adjustments to reduce the overall 2021 long-term care funding requirements. That would just give us some leeway if there is additional funding or we find things that we can do to change things here, that we'd have that latitude and support from the committee.
Okay.
So,
Mr.
Mr.
Chair, as
Chair.
the mover, I absolutely support that. Thank you, Kevin, for bringing that forward.
Okay. Madam Clerk, you will make that change?
Well, we need to move an amendment. So moved by Councillor Robinson, and I saw Councillor Mackey's hand up to move the amendment. So then you would just need to vote on the amendment, and then we'll vote on the main motion as amended.
Thank you. Is there any opposition to the amendment motion? Seeing none, it is carried. Okay. Now we will vote on the main motion. Is there anyone in opposition? Seeing none, it's carried. Okay. Thank you for the great work, ladies. We'll move on for our agenda. Then we're down to resolution from North Glengarry. Madam CEO, I've seen you smiling. Does that mean you want to comment on this? Does anyone want to comment on the correspondence? Was the correspondence just for information?
It's just to be received for information.
Yes, sorry.
Motion? Yes.
That's what I was going to say, but I couldn't get my mute button to work.
It's okay.
Okay, so that's just for information then.
You do need a motion, though, to receive it for information, so you will require a mover and a seconder and a vote, Mr. Chair.
Okay, it was moved by Brian, second by Scott. Is there anyone opposed to accepting this motion? Seeing none, it is carried. Okay. So we are down to, our next meeting is January January 12th. Wow. 2021. Time flies.
Merry Christmas, everyone.
Do we need a motion to adjourn? No,
Yes, you do.
we do.
Yes.
Moved by Brian, second by Christine. A motion to adjourn. Is there anyone opposed? Seeing none, we are now adjourned.